Did you come to this video because you feel tingling in your little finger and ring finger? Have you already been to the doctor and they tell you there's nothing to be done? Then watch until the end, because I'm going to help you solve your ulnar nerve injury once and for all. Folks, the ulnar nerve can be compressed here at the elbow, which is the cubital tunnel syndrome. The cubital tunnel is a place where it passes here at the elbow. The same place where when you hit the table, you feel that little shock that goes to the little finger. Or you might have Guyon's canal syndrome. Guyon is the name of the person who gave the nomenclature for the ulnar nerve when it passes here in this wrist region. So, there are two types of patients who might be watching this video. One of them is the patient who has spontaneous nerve compression. In other words, it started with tingling because they use their hand a lot. It gets worse when they sleep and bend with the hand bent. And there's the other patient who has tingling after a fall where they hit this nerve. Which of these patients are you? Comment below because I want to know, and stay until the end of this video because I will provide a solution for both cases. First of all, if you hit your nerve, had an injury, an accident where this nerve was pinched, cut, or crushed, seek a peripheral nerve specialist immediately. I am a neurosurgeon who works in this area. With surgeries, I treat patients so that the nerve is relieved and they can improve. Symptoms like loss of strength, loss of sensitivity, and even improved tingling sensations. Not all cases of more severe injuries can be completely recovered. However, the sooner you seek help, the better the outcome of your treatment. If you had an accident and have a milder injury, your symptoms are probably similar to those of a patient with nerve compression, starting with a slight tingling, then progressing to loss of sensitivity, worsening over time. It worsens when using the cell phone. It worsens when using the computer and when sleeping with the hand bent. So folks, let's talk about ulnar nerve compression, why it happens, and the best way to solve this problem. Shall we? So, first of all, you need to believe and understand something I'm going to tell you now. It might even hurt a little for you, but you need to understand this. The blame for your ulnar nerve compression is yours. You weren't born with this problem. You developed it over time as you used your hands a lot, bent your elbow frequently, and slept on your arm. Your nerve is designed to move along with your arm, however. It is not meant to stay in the same position, bent for several hours. So if you are spending a lot of time on your phone, it starts with tingling. Or you sleep and wake up at night with your whole hand tingling. You have to shake it, you're probably sleeping with the nerve twisted, and that's what's causing your symptoms to worsen. So, first of all, the first tip and advice you need to hear from this video is to stop doing what you're doing that's compressing your nerve, Dr. Thomas. But I don't have a medication that I can use to improve these symptoms I'm experiencing. Folks, put your hand on your conscience and think about this. Will a medication really prevent your nerve from being compressed when you sleep on your arm? Of course not. So you go to one doctor, then another, asking for medication, asking for exercises. And then at night, you do everything the same way. You bend your elbow and sleep on your arm. And during the day, you're on your phone all day long. Medication won't help. First of all, remove the triggering factor. I hope you understood this because I think this is the most important tip of this video. And now I have a few more tips to give you. Stay until the end, because it will be extremely important. Tip number 2, warning signs. If by any chance you noticed that, last week it was just tingling. Now, it seems completely numb. Or last month it was just numb, and now I try to hold an object, and I can't grab it because I can't squeeze. The glass falls, the cup falls, or you try to open a jar and you can't open the lid. This is a warning sign you are losing function in your hand. It is no longer something conservative. It's not just something you can change at home or with physical therapy. Has it become something that might require surgery? So, losing hand function is not normal, folks. You need to seek a specialist immediately. You found a specialist. It could be Dr. Thomas Marcolini, or it could be another doctor who specializes in peripheral nerves. It could even be a hand surgeon who deals with this area of nerves as well. What will he do? If it's a milder case, just like we mentioned first, he will give you guidance such as occupational therapy, physical therapy, and changes in daily habits. Speaking of habit changes, here are 3 extremely important tips that will help you improve this symptom. First, on the computer, When you spend a lot of time on the computer, avoid bringing your arms too close. Because when you bring your arms too close, you end up keeping the elbow very bent and the nerve very twisted. Another important factor is the following: avoid using very high mice. Because if you bring the elbow too close and your mouse is very high, besides bending the elbow here, in other words, you bend your ulnar nerve. Here, you also bend it here. And then you do a double bend of your nerve, and then it gets worse. So, elbow more forward, and preferably support for the forearm or a lower mouse, so that you keep the nerve straight and don't experience symptoms while working on the computer. Another important factor is the way you use your cell phone. Let's do it in practice here. How should you use your cell phone so that you don't suffer from cubital tunnel syndrome? Well, most people use it like this, with the wrist bent, elbow bent. This causes you to twist the nerve at 2 points and worsens your symptoms throughout the day. Oh, doctor, but does just bending the nerve make it worse? Imagine staying for 2 hours with your nerve bent. There's a lack of blood, lack of oxygen, and the nerve becomes swollen, and you get worse. So avoid the time the nerve is compressed, both when sleeping, at the computer, and now with the cell phone. One way to help is the following. Keep the arm further from the body and don't keep the wrist bent, keep it straight. And then you move like this. It's a way that you don't keep the ulnar nerve bent here at the elbow and don't keep the ulnar nerve bent there at the wrist. This will greatly help in improving your symptoms. If by chance you couldn't use the cell phone like this, and you need to use it a lot, move WhatsApp to the computer. Maybe this will greatly facilitate your day and relieve the pressure on your nerve. Finally, an important tip for when you're sleeping. If you notice that your biggest problem with nerve compression, most of your symptoms occur at night, some tips will help you a lot. The first one, place a folded towel on the elbow. This will prevent you from bending your elbow at night and will relieve your symptoms. If by chance you also sleep with your wrist bent, or you can use a wrist brace, like those available in orthopedic supply stores, or you can also wrap a towel around your wrist. I know it's uncomfortable, but if your symptoms are worsening and you're suffering a lot from it, to avoid the need for surgery, it can be a very interesting solution. Folks, I hope you understood all the tips, because it's not right to undergo decompression surgery or use medication to decompress the nerve, which, in reality, is something you can change in your daily life to improve. If you like this information, and this video helped you, I hope you like this video, and follow our channel. If you want to know more information, click on these videos here in the card, because there will be a lot of important information to help you improve ulnar nerve syndrome. A hug,